All right. Well, hello, everyone. Good morning. Welcome to Roswell Park's second Ask the Experts webinar. I'm Rebecca Vogt. I'm the Media Relations Specialist at Roswell Park Comprehensive Cancer Center in Buffalo, New York. Now, to those of you joining us for the first time, we want to welcome you. We hope you find this series both informational and helpful. Now, for those of you guys returning, first of all, I want to thank you for tuning in last week. It was fantastic to see so many people joining in. We're so glad to have you back, and we are going to be sure to cover new questions today. Now, we know that cancer patients have many questions during the COVID-19 pandemic, and we are going to be bringing you this free webinar series every Friday to cover a variety of topics and also feature a number of experts. Last week, we covered continuing cancer care during COVID-19, including who can delay treatment or appointments and who cannot. That full video is available for on-demand viewing on our Facebook page and also YouTube channel, as well as roswellpark.org/patient webinars. Now today, we're going to be discussing how Roswell Park is focusing on keeping cancer patients who do have to come to Roswell safe during COVID-19. We've made a lot of changes to mitigate risk, and we also wanted to bring your questions straight to two of the leaders who are helping implement new policies and protocols. Now, first, we are going to start off with Dr. Boris Kushanoff. He is the Chief Medical Officer here at Roswell, and also Dr. Kushanoff happens to be a cancer survivor. Thank you for joining us, Dr. Kushanoff. Share a little bit about yourself.
Oh, thank you, Rebecca. So I've been at Roswell now 18 years, and I am currently in the role as the Chief Medical Officer. I'm also a practicing surgeon, however, and I specialize in cancers of the pancreas, liver, and neuroendocrine tumors.
Fantastic. Thank you so much, Dr. Kushanoff. We are also very fortunate to be joined by Dr. Catherine Mullen. She is our Director of Infection Control and Prevention. Dr. Mullen, welcome.
Thanks, Rebecca. Thanks for having me. So I am a infectious disease physician here at Roswell Park. So I spend some of my time seeing patients who may have infections, or there's a concern that they have infections here at Roswell. And then I'm also the Director of Infection Control and Prevention. So spend a lot of my time thinking about how we can minimize any risk of development of infections here for our patients.
Fantastic. Thank you so much, Dr. Mullen. So the COVID-19 pandemic, as we even talked about last week, it really has sort of flipped the switch of how much we do really much of anything these days. And we continue to hear from patients who are afraid to leave their homes and come to Roswell Park for treatment. We do know that there are several questions still out there. We are here to answer them for you. We do have several pre-submitted questions first, but also know that you can use the chat feature down below to submit your own questions throughout the next 30 minutes or so. Please make sure you send your question just to the panelists, or you can check mark the box called anonymous if you do not wish to have your name associated with the question. So a couple of options there, but know that there is a chat option and you can drop your questions below. That all being said, let's get started. I guess one of the biggest questions we want to throw out there both to Dr. Kushanoff and Dr. Mullen is Roswell Park still operational? Should I even feel safe coming in?
Yeah, I'll start with that. So absolutely. Obviously, when this hit us, we had to make some decisions about decreasing the volume of traffic through the cancer center. So we want to abide by the social distancing rules, and we've developed our own policies to make sure that we avoid crowding. So we started by trying to identify any patient that could be managed through what we call a virtual visit. So rather than coming to the hospital and having your appointment, we would actually have visits with the patients using telecommunication, especially using video chat technology, so that we could continue on with their care without them having to be physically here. Now, in some cases, patients need to be here. If you're getting therapy, or you need scans, or you need surgery, obviously care of the cancer is foremost in our concern. So right now, it's a blend of having patients come in if we need to see them, and being able to manage their care from home if that's safe and feasible.
All right. Moving right along, how should I prepare myself to come in for blood work or diagnostics? We did actually have a question come through the Q&A saying, is blood work still open?
Yeah.
I guess, oh, sorry, go ahead, Doris.
Go ahead, Dr. Mellon, please.
We're definitely, phlebotomy is still open to get blood work. And as Dr. Kushnoff mentioned, obviously there are patients that we need to take care of. We need to keep making sure that we stay on top of their lab results and things like that. And so, as Dr. Kushnoff mentioned, we have taken a lot of measures to decrease traffic in the hospital, which will allow optimal safety for patients who do need to come in to get things like blood work or CT scans, or to see their physician in some cases.
I'm muted, so sorry about that. Moving right along, so are you providing masks to patients who have to come in for appointment? This was actually something that was brought up yesterday during our physician chat. So yeah, I'm gonna pose it all to you guys about, yeah, masks for patients who have to come in for an appointment.
Yeah, a couple of, as you know, there was the governor sent out a healthcare advisory that all businesses now that face the public need to have masks. So at Roswell Park, obviously, we need to take that directive, but even take it to a higher level wherever possible. So right now, we have what's called a universal masking policy. So everybody that comes into the institute, especially in any area where we're providing healthcare, which we call the healthcare space, and that would be the hospital, the clinics, the Scott Beeler building where we do patient care. Everybody is wearing a mask, both employees, healthcare workers, and patients, and their visitor family member that comes with them. So everybody is in a mask.
Okay. So that all being said, are you providing masks? Did I miss that part? Are you providing?
Yes, we are providing masks. So if the recommendation is that anytime you're going anywhere where you may have to interact with someone closer than 6 feet, you should have a mask with you. So we hope that many of our patients also have, contingency plans for wearing masks when they're not at Roswell. But when you come to Roswell, we will provide you, and if there's a caregiver with you to sort of accompany you to phlebotomy or something like that, we are providing masks.
Okay, kind of on that same vein, I mean, should someone be coming in wearing gloves, any sort of specific way that they should be dressing, etc.?
I would actually say no to that. I think that the most important, hand hygiene is actually the most important thing. So more important than wearing masks, the most important thing is good hand hygiene. We around the Cancer Institute, we have multiple opportunities to practice good hand hygiene in terms of having hand sanitizer and things like that available everywhere. But if you wear gloves, you're touching a lot of surfaces and you can actually spread contaminants. And so I would recommend not wearing gloves.
Yeah, I would concur. I think it's safer to keep your hands clean than to wear a mask. I'm sorry, than wear gloves all day. So you can manage the sanitation of your hands much better than wearing a glove all day.
Okay. I mean, we talk about dress because I know that there has been so many talks about how, for staffers at least, if you're wearing something, to a hospital, when you come home, you should immediately take it off, take a shower, before you go out to go grocery shopping and everything like that. I think that is sort of the same question kind of coming through from patients, should I be wearing the clothes that I wore to the hospital, back in through the threshold of my house when I get home, or should patients be changing right away when they get home?
I would say that that's really not necessary, but up to someone's personal comfort level. I think when we talk about healthcare workers and some of them who are actively taking care of patients who are infected, we know that they have infections or that they may have infections and it's unclear, testing isn't back yet, they're being ruled out. I think that's a separate situation from someone who's coming in to Roswell from the outside who isn't sick, who needs routine cancer care. And we are doing our utmost to make sure that there's almost absent risk from them getting having any interaction with something that could put them at risk at Roswell itself. And so I don't think that that's necessary. However, if someone feels more comfortable doing that, if that's going to make you less anxious, then feel free to change your clothes. One trick that, if it is something that someone is interested in, one trick that I learned is that if you you can put your clothes in a pillowcase, and then just dump everything in the washer dryer, and including the pillowcase, and you can get rid of anything that you may have worn. But again, I really don't think that is necessary.
Okay. Great. Now, speaking of, you have your patients, but you also have, their visitors. There's a spouse, a caregiver, what have you. So can spouses or caregivers come to appointments with individuals? They really need the support right now. And then secondary, should they be following the same protocol?
Yeah, I can start with that one. So on the hospital side, the inpatient side, there are directives from the governor that we have to, follow. And for patients that are in the hospital, we have a restrictive visitor policy at this time. So unless there are certain situations like a patient needs a caregiver for a medical reason, they would be allowed. Or if somebody is at what we would say end of life, then obviously a visitor would be allowed. But for most of our inpatients, we've had to restrict visitors. Now, on the outpatient side, because Roswell Park is ambulatory, clinics where patients come in for chemotherapy and radiation and doctor's visits, we do allow one visitor or a companion or caregiver. And we treat them just like the patients in terms of giving them a mask and protecting them as best we can from transmission, including the social distancing. And so basically one visitor on the outpatient side and restricted visitation on the inpatient side.
Thank you, Dr. Kushinoff. One question we have coming through: are patients' temperatures being checked? And what happens if they have a fever?
So I can take that one. So we are temperature checking everyone who comes into the institution, whether they're an employee or a patient or a caregiver that's with a patient. That's just part of our standard screening. If it's a patient, they may have a fever, and they may sort of what we call screen positive, because they have other issues going on. We have complications related to cancer care that include fevers, and we need to take care of that patient. So that would be a separate process then. If a caregiver screened positive, if the caregiver has any symptoms that could be related to COVID-19 or elevated temperature, they should not be coming into the institution.
Okay. That kind of leads into the next question. I mean, are we testing patients for COVID? When are we testing them? Yeah, I'll let you guys sort of tackle that twofold thing.
Dr. Mullen, I'll let you.
Sure.
That one.
Yeah, so we are the patients that we are actually treating for cancer. We are, and if there's a concern that they have symptoms that could be related to COVID, we are testing them. Yes.
Right. So that also, again, folds into another question. We've heard that some employees have tested positive. Should patients be concerned about this?
We are testing employees when they show symptoms. And actually at this point, when you look at the total number of employees we have, well less than 1% of our employees have tested positive. We haven't linked any of those positive tests with direct patient care. Our feeling is that our employees are just as much as risk of acquiring COVID from the community. And most of the cases we've seen with employees, again, a very small number, are probably community acquired. We can't say that for sure, but you have to remember employees are just at risk of anybody in the community, just like anyone else would, or a patient for that matter.
Yeah, I would reiterate that there's no current concern that employees that there was any link related to Roswell and those employees who tested positive.
We've actually, the employees that have been taking care of the COVID positive patients in the hospital, we've not had any cases of those direct employees who are directly taking care of COVID patients. So we've been very fortunate to date.
Now, when we talk about directly taking care of COVID patients, are COVID patients being cared for on a special designated floor?
For patients that are diagnosed with COVID, we do have a floor that's focused on those patients. However, we have to remember that these patients also have complex cancers. So really, we try to put the patients with COVID together so that we can, decrease the risk of spread to other patients, and also so that the staff that takes care of the patients can do it in one designated area. However, we have to remember that we're taking care of patients with leukemia, bone marrow transplants, patients with complex surgical procedures, and those patients need to be in the safest area to care for their cancer. We have nurses who are specialized in taking care of patients with particular problems. So we don't want to forget about the patients still need cancer care, and we want to put them in the safest environment to take care of their cancer, while also trying to decrease the risk as much as possible of spread of the coronavirus within the hospital.
Yeah, and I would just add that the vast majority of the patients that we're testing for COVID are testing negative because they have other reasons to have symptoms that also could mimic COVID symptoms. So that's all, just echoing Dr. Kushinov's point, it's really important that, we make sure that our patients who are here for oncology care are getting the best care for their underlying malignancy.
Yeah. We also, I'll add one more thing, we're also testing all the patients who are being admitted to the hospital. So as whether it's a planned admission or an unplanned admission, all the patients are now getting tested.
Okay, because that does sort of lead into, if a patient is sick with COVID, can they still be treated at Roswell for their cancer? They're at home, they're starting to feel the symptoms, like say they went to a testing site and tested positive, but they still need to come in for treatment. Can they?
Yeah. Absolutely. I mean, we, as a cancer center, obviously we are focused on caring for cancer, and whether or not you have COVID is just another medical issue that we have to deal with. But absolutely, just because you have COVID doesn't mean we're not going to take care of your cancer problem or your surgical problem.
Yeah, and I will say, as an infectious disease specialist, this is just one of a number of infectious diseases that we may encounter in the setting of cancer care. So we are very well attuned to dealing with patients that have superimposed infections on top of an oncology issue. So it's something that we have to sort of factor in to treatment, but we absolutely want to make sure that patients are getting the most aggressive care for their cancer as possible.
Absolutely. Now, switching away from the patient and kind of moving on to, say, a loved one or an individual that they live with at home, we are seeing some questions come into the chat window. What happens if, someone I know, someone I love, my caretaker, had COVID-19 or thinks they do, or even cleared the 14-day window? Can I still get my treatment?
So sorry, Rebecca, just so I understand the question. The question is regarding a patient who's had a close contact who's been exposed to COVID-19 or been diagnosed with COVID-19.
Yep.
I will, obviously Dr. Kushinov may have some thoughts on this too. I would say that obviously we want to minimize any known exposure. Our patients want to minimize any known exposures to people who have tested positive or there's concern that they may have COVID-19. So, minimizing contact, it would be recommended and key. However, again, we would take this in a case-by-case basis in terms of the recommendations as related to their cancer care. Obviously, just because you have a close contact doesn't mean you will necessarily develop the disease, but we would obviously want to make sure that you're not more at risk for development of the disease because of that exposure.
Okay. And now, speaking though of said loved one, say the loved one, it has cleared that 2-week window, they're in all sense and purpose of the world, they're okay in a sense. Can they be around a loved one who needs, cancer treatment, who is getting treatment?
Yeah, I think in those circumstances, yes, I think the risk would be very low once you, um, most of the, what we say incubation period is an average of about 5 or 6 days, but it can extend longer than that. But generally after 2 weeks, if you've been exposed to somebody, you're out of that sort of danger zone. And I think you can just exercise your typical social distancing and masking where appropriate, and you know, exercise today's usual precautions.
We do have several questions that have come in related to immunocompromised patients, et cetera. One such, if a patient is getting radiation treatment, are they still considered immunocompromised?
I think in that case, it depends on what the radiation is. There's many different kinds of radiation. In general, I would say for focal radiation, like just to a particular area, that would not cause general immunosuppression like you would see with chemotherapy, for example.
I would agree with that too.
Okay, fantastic, thank you. One other thing that came up though, in that sort of same vein, you have someone who is 11 years out from chemo, but their white blood cell counts are still below normal range. Are they considered immunocompromised?
I think anytime that you've had a history of cancer in the past, and they may have white blood cell count ranges that are lower than usual, we would consider them more at risk than the general population. But again, immunocompromised is sort of a broad spectrum. So I think the general message should be that we should be doing everything to protect anyone who has any vulnerability from exposures. And the key to that is diminishing the number of cases in our local community, which is why we, as a region, nationally, internationally, there's been this big push for extreme social distancing so that we do minimize that burden to people who may have a variety of different susceptibilities.
And now kind of moving on to just another sort of topic that has been, I guess, at top of mind for a lot of people. If people have been tuning in to the number of press conferences that have been happening, whether it be Governor Cuomo or Erie County or even President Trump. I mean, I know President Trump has talked about a new drug. So is Roswell Park giving patients the new drug that the president has talked about in the case that someone is COVID-19 positive?
Sorry, I'm not as facile at moving these Zoom tools. So the president's talked about a variety of therapies. Anything that is there's no approved therapy for COVID-19. So I just wanted to be clear about that. There are some trial drugs that may be thought to have may help in some way, either diminishing the virus or diminishing the immune response to the virus, because we think a lot of the damage actually comes from a hyperimmune response to having the virus. And so we are engaged in a number of clinical trials related to treating COVID-19 patients. And again, it would be based on, whatever the patient's underlying profile is whether or not we would be able to treat them with certain drugs.
Yeah. Rebecca, I just wanted to clarify one of the previous questions. I was looking at some of the chats that came in. One of the questions about if you actually had COVID and you had a family member, the one thing we need to add to that 14-day window is that you have to test negative at least once if you're an outpatient. If you're an inpatient, we like to have 2 negative tests, but if you've had COVID, you're really not cleared to have contact with your loved ones who might be going through cancer treatment until you've had a negative COVID test.
Thank you, Dr. Kushnoff, for clarifying that. One interesting question that did just pop up as we are starting to get sort of to that wrap-up phase, but one last good question here. Are immunotherapy patients safer from contracting COVID?
I would say that we definitely do not know enough about that to say definitive yay or nay. But again, I would just go on. We know that any person who has any other medical conditions is more at risk for having a severe case of COVID. So I would consider immunotherapy patients to be also in that bucket of having a significant medical conditions that's requiring the immunotherapy. And so I would say that they're more at high risk. But again, specific nuanced things to immunotherapy versus other more standard treatments, we don't have any definitive data on that yet.
Okay.
It's kind
And
of a complex question because some of the immunotherapy drugs that are used for rheumatoid arthritis, for example, are being considered as therapeutics. But on the other hand, patients are immunosuppressed because they're on different cancer immunotherapy drugs, may be at more risk. So it's like, as Dr. Mullen said, it's very complicated. And unfortunately, we have a lot more to learn about that.
Okay. And is there anything that can be done for a patient who is on chemo right now, doing chemo, to potentially boost their immunity?
In terms of boosting your immunity, I would just say, the key is to staying, generally healthy from other things. So again, doing best practices in terms of washing your hands, making sure you're not having sort of high risk exposures, and minimizing sort of time in busy places where you can't maintain that 6 feet away from people, or you're not sure of that. But in terms of boosting your immune system, there's no, if there was something like that, everyone would be taking it. So I wish it was, I wish I could say that we had some sort of secret vitamin or something out there, but I would say just generally trying to keep as safe and healthy as possible would put you in the best position if you did have an interaction with this virus.
Yeah.
Fantastic.
I mean, typically things that boost your immune system are getting rest, making sure that you're, remain some level of activity. I think all the things we normally do to stay healthy, eat well, rest, are all things that boost your immune system.
And probably I would say also not watching the news 24 hours a day, because with everything that's going on right now, I think it's inescapable that if you are just watching the news about COVID-19 every day, it would be understandable why your anxiety would be sky high. And so I think that all those things have interplay with things like sleep and eating and things like that. So.
Okay. Thank you. Much like last week, the time has absolutely flown by. Before we close, any sort of final thoughts from either of you?
Well, I think unfortunately this is going to be with us for a while. So I think we all have to adjust to what the new normal is going to be. Someday we are going to have a vaccine, and we are going to have treatments like we've done for many of the other viruses that have come down the pike. So I think we have to have patience. I think we have to exercise the social distancing that we've talked about, wear masks when it's appropriate. And I think if we lower our guard and we become complacent and stop doing that, I think we put ourselves at risk of not flattening the curve, but having the curve go back up again. So I think we have to stay vigilant. That would be my thoughts.
I would echo a lot of what Dr. Kushnoff said. I mean, I think over the next couple months, we're going to have to talk about sort of a graded approach as we hopefully smother out any viruses in the community, but it's going to take a while, and we're going to have to sort of reintegrate in a slow, stepwise fashion to do it safely and protect all of our patients. I guess I would also reiterate that, we have been very, very proactive about taking measures to keep our patients safe, and their safety is utmost important in our mind, and that in our employees as well. So I think people should feel like if and when they need to come to Roswell to get care, they should feel like they're going to be taken care of very well, and that we're putting 100% of our effort into making sure that they will continue to get top-notch cancer care.
Fantastic. Well, I want to say to both Dr. Kushnoff and Dr. Mullen, thank you guys both so much for taking time out of your busy schedules. We know you are very, very busy at this time. So thank you again so much. And thank you to all of the folks who have tuned in this morning for our webinar. Now, if any of your questions were not answered, we do encourage you to reach out to your care team, as well as also tune into future webinars. These are still going on. We're going to be addressing even more topics and questions. We do consistently update our COVID-19 page on our website that does have additional FAQs and more, and that you can check out at roswellpark.org/coronavirus. The video from today will be available to view on demand, and a link will also be sent to your email. So again, you can email it out to anyone who did not tune in this week. Then you can also watch some of the other videos too. They're also on our YouTube page. So, so you can keep to date on everything that's been going on. We do encourage you to stay tuned to roswellpark.org/ Patients webinars. I do again want to emphasize that that's plural, patients webinars, and also your email to register for these upcoming webinars, and they're going to be offered every Friday. So that being said, have a wonderful day, a great Friday, a very good weekend, and thanks again for tuning in. Bye, everyone.
Hi. Thank
Okay.
you. Have a good day.
Thanks. Bye-bye.